Go ahead, you have 5 minutes.
Okay. Good morning, Chair, members of the Board of Health, and welcome, Dr. Murdy. My name is Arlene Dias, and I'm a licensed registered nurse with a Bachelor of Science degree in nursing. I've been working with the City of Toronto for the past 22 years, proudly as a public health nurse. I'm deputing today to address how compensation for public health nurses needs to be a top priority in the 2026 budget. Public health nurses work in various programs at the City of Toronto under Ontario Public Health Standards in the community as essential workers. We work on the front lines in residents' homes, at schools, in hospitals, shelters, and in vaccine, breastfeeding, and sexual health clinics. I'm currently working in the Investing in Families program, which is a unique and integrated partnership between 6 city divisions. We serve families living in Ontario Works. Some are newcomers, refugees, victims of domestic violence, war, and single parents. As a public health nurse, I work together with families to improve their physical health and well-being by increasing their connections to services such as parenting, recreation, childcare, housing, food security programs, and library services. Currently, public health is facing a recruitment and retention crisis. Public health nurses are leaving the City of Toronto for higher paying jobs, and numerous others are nearing retirements. Those of us who remain are left to carry heavier caseloads, and some of our programs, including mine, now have wait lists. Wait lists are a real threat to the quality and consistency of care we provide. When programs do not have enough nurses to provide timely services, Toronto's residents lose access to the prevention, surveillance, education, and rapid response that keep our communities healthy and safe. Did you know that even after our recent contract negotiations, Toronto public health nurses are still among the lowest paid nurses compared to our colleagues across Canada, despite serving a city of nearly 3 million residents, the largest and most diverse population in the country? Our profession is not only vital to the well-being of the city's 3 million residents, but it's also a workforce made up predominantly of women. Unlike many male-dominated professions, public health nursing has historically been undervalued, unfortunately reflected in the lower wages we currently receive. Pay equity is not just about fairness for nurses, it's about recognizing the essential gendered nature of our work and ensuring that women in healthcare are compensated with the same respect and value that other professions already receive. In March 2025, Toronto City Councillors recently approved a pay raise of nearly 25% after findings that their workload had grown and their wages lagged behind other municipalities. Public health nurses face the very same reality. We serve the same population, and our responsibilities have also increased, yet our wages trail far behind our peers. Our request is much more modest, a fair wage adjustment to simply bring us closer in line with other public health units across Canada. It's also becoming harder to attract new nurses into public health because salaries are higher in other healthcare settings. Many of us, myself included, are also forced to work second jobs in hospitals, casually or part-time, to make ends meet. Also, many new grads or experienced nurses want full-time permanent jobs rather than contract and temporary positions offered here at the City of Toronto. Stable jobs lead to stable services for Toronto residents, where we can build lasting relationships with clients, stay committed to our programs, and reduce turnover. In closing, I would like to reiterate our request of support from the board to include a wage adjustment for the public health nurses as a top priority in the 2026 budget, to bring us closer in line with other public health units across Canada. A fair raise will demonstrate how the City of Toronto values our work as public health nurses and is committed to strengthening and expanding our workforce, ensuring that the City of Toronto can achieve its vision of a healthier, more equitable, affordable, and resilient Toronto for all the 3 million residents, because they are worth it, and so are we. Thank you for your time and attention.
Thank you. Any questions for the Deputant? Councillor Chang, go ahead.
Thank you. Thank you for your deputation. On this budget, I see that there's a $6.4 million adjustment for COLA. And I'm wondering, what is that proposal that you're saying would make the adjustment that would become more competitive? What would that number be?
So the public health nurse, our wages are not, we don't receive COLA. We just receive the wages that are negotiated with our union. So.
So the
don't have,
union
I
does
don't know
not
the figures.
apply COLA every, so are you saying the union negotiations don't take COLA into account?
I think that it's reflected just for management, but not for employees, but I'm not sure.
I see. Okay, and what would that suggestion be then? Like, do you have a percentage of what you think would bring people to a more competitive wage?
My colleague is also going to state her deputation next, and she has figures. It's
Okay.
just in line with what the other public health nurses in other public health units are earning.
Okay, thank you so much for your deputation.
Thank you for your question.
Thank you. I do have one question.
Sure.
So in your deputation, you mentioned that QB 79 just went through negotiations with the contracts.
Yeah.
But you're stepping out of that and coming to the board asking for an increase. Why was that not negotiated within QP 79?
So it was negotiated. However, the city deemed only 32 divisions as having a retention and recruitment crisis, and therefore those divisions received a wage increase. Public health nurses did not receive that. The nurses in the city home long-term care homes received it. So there's like a division in terms of public health nurses and our long-term care home nurses that are considered essential workers, but we're not. So 32 divisions received a special wage adjustment, and our division did not. Because they deemed, like during COVID, there was a mass hiring of nurses, so on paper it looks like we have staff, but they were hired on contract, and then now they've all been let go. So we're left back to current staffing, which are a lot of senior nurses, and a lot of them are going to be retiring soon. And the ones that we are hiring, they have to be trained. It takes a long time, so it's affecting client services.
Okay, thank you. Any other questions from the board, directors? Seeing none, thank you so much.
Thank you.
Next up is Marini Moody.